Services. And as a reminder, if everyone could be directed to using the Q&A feature that you will find on the webinar. If you have any questions for us, we will cover a lot of territory, so chances are some of your general questions will be answered. This webinar is also recorded, so you'll be able to refer to it afterwards. And if you could put your questions in the Q&A. If we're unable to get to all the questions in the time that we have today, we will post the answers to commonly asked questions afterwards and email all of our attendees so they can refer to the answers online. Joining me today are several of my colleagues from our counseling and mental health team. First of all, I'd like to introduce Nina Sun. Nina Sun is a licensed therapist. She's also specializing in our international student population. She's with our counseling and mental health team. Also with us are Dr. Vinisha Rana, clinical psychologist with our counseling and mental health team, and Dr. Janavi Pandya, currently a psychology intern. She is also with our counseling and mental health team. Colleagues, I welcome you all to this exciting session where we get to interact with this year's incoming class and their families. So a warm welcome to all of you and a warm welcome to my colleagues. I will hand it over to Nina Sun to self-introduce and say a few words.
Thank you, Minnie. Hi, everybody. My name is Nina. My Chinese name is Sun Yiting. I'm the embedded counselor at Counseling Mental Health for the Office of International Services, and I am actually a USC graduate as well. So I'm really excited to meet everybody, and I hope I'll see and meet a lot of you guys in the future. And welcome to the seminar today. And I see there's some Chinese folks here. I just want to do a quick introduction in Mandarin as well. 大家好，我叫孙怡婷，我是 USC 这个学生心理健康中心的咨询师之一，也是一位镶嵌式的咨询师给国际学生。然后我会在未来进行一些推广会啊、宣传会啊、各种讲座活动，希望未来可以跟大家有机会见面，认识大家。谢谢。And I can pass it on to Vinisha if you want to introduce yourself as well.
Good morning, everyone. My name is Dr. Vinisha Rana. Yes, I'm also one of the clinical psychologists working here. I'm embedded in the LGBTQ Center. Welcome. I'm very excited to support all of your students as they are working towards succeeding at college. We're going to share a little bit about all the services we have to offer, but we just want you all to know that we are here and ready to support. And I'll pass over to Janvi.
Thank you. Hi, everyone. I'm Janvi. I am originally from Mumbai, did my master's there in counseling psychology and came here for a PhD. I'm currently at USC, but will be transitioning for my postdoc very soon. But I'm happy to answer any questions that you might have.
Great. Oh, and I see our other colleague, Vaishali Jadhav, have joined us. So would you like to self-introduce?
Hey, hi everybody, I'm Vaishali and I'm also based out of Mumbai, India. I work from the India office here and I typically, interact with students who are before applying for their masters, during their whole process, and be with them throughout the journey so that they do. And I'm so glad that I'm here today. This is my very first health service session that I'm joining, and I'm very excited to know more about it as well. Thank you so much, Minnie, for having me here, and glad to meet everybody, all of my colleagues. Welcome to the students as well.
Thank you so much. And without further ado, we'll go into our presentation. As I mentioned, please feel free to use the Q&A feature if you have questions. And if we don't get them to all of them today, we will post the answers. So do put your questions in there if we haven't covered something. So here at Student Health, we will be your home for healthcare, and we are centered around you. It's what we call you-centered care. And for all of our students, this includes medical care, including primary and specialist care, with on-site lab and radiology services. So there's quite a lot you can get done here at Student Health. And as our colleagues have talked about in their area, we also offer exceptional college mental health services. We have about, I think, 60 to 80 colleagues at any given time in the mental health specialty area. We also have a private practice that is insurance-based on our 5th floor, which is comprised about of another 15 to 20 specialists there. So we really consider our college mental health services one of the best in the country. And we also do comprehensive campus public health. So immunizations, education campaigns. We do quite a bit of work getting our students involved in educating their peers about ways to enhance and protect their health and well-being and really allow them to make the most of their experience at USC and in the United States. So we are an all-in-one campus-based health organization. All of our services are funded through what we call the student health fee. This is a fee that is charged every semester. This semester, for this year, it is $720. And so all of the services that are in student health, there's no copay, there's no need to utilize insurance. This is all existing for students through the health fee. Now, who pays the health fee? The health fee is added for all students who take 6 credits or more every semester, students who are studying in the health sciences professions, students who are international, or students who are in the PhD programs. So all of those students automatically have the 720 added to their account. The students who do not participate in the 720 student health fee are online only students. Those are students who are not coming to campus, and also students who are taking less than 6 credits. So they are attending maybe 1 class. But all other students participate in the fee and have access to all of this care that Student Health provides. A little about how you can access these services. We have 2 physical locations, one on each of our academic campuses. So the University Park campus, which is where the undergraduates are, is the Engelman Student Health Center. It is 5 floors of health services primarily for our students only. So this includes medical care, this includes mental health services, prevention services, workshops, and we also have a insurance-based mental health clinic on the 5th floor. This building also is a location that houses our physical therapy and occupational therapy services. Some of those visits can be, appointments can be made straight through your student health portal. They're included as part of your fee as well. So even though University Park is what we call the undergrad campus, of course, all the undergrads are at this campus, but we have many, many graduate students there as well. So if you are a graduate student and you are attending this webinar, just know that if University Park is your main campus, Engelman will probably be your primary physical resource for healthcare. Eric Cohen Student Health Center is on the Health Sciences campus. It's actually located in the main medical plaza with Keck and Norris hospitals. It is in HC1, right next to the ground floor pharmacy. So it is a smaller clinic. Mostly it is the health science students who access services at that site, but all students can access either campus at any time. And of course, we also have the option of telehealth services. Telehealth services are available 7 days a week for students during the academic year. And those services generally start at 7 a.m. On weekdays and extend until 9 p.m. We also have telehealth hours on Saturday and Sunday. In addition to that, we have a 24/7 telephone number, and this number is answered by our own student health representatives, and part of that team is an advice nurse. So for students who have a minor medical issue that they'd like to discuss and get some consultation on, an advice nurse is available to you 24/7. This is also available for students who might need to be making an appointment early the next day. It's late at night, they think it's manageable, but they really want to be seen as soon as possible the next day. That team can make you an appointment for the next day, so you can be seen quite early. That line also connects to emergency services for a counselor on call for urgent mental health matters. So it really is a comprehensive number for services for anyone who needs healthcare, health services. So we want students to put that number in your phone and remember that it's available to you, graduate and undergraduate students. So we have a wide number of medical providers available to our students, and they are board certified faculty physicians, physician assistants, and nurse practitioners. And we have specialists in a number of areas where college health is very important. So we have specialists in allergy, in dermatology, in gynecology and obstetrics and sexual health. So these are all services that are part of student health and are included as part of your student health fee. So some of the popular services that we would like students to know about include acne treatment and dermatology, very common in the college population. As I mentioned, we have a number of psychotherapy services located not just in our two main student health centers, but we also have them at numerous locations across campus, and we'll talk about that a little later on. One of the programs that we do want students to know about is a service called Let's Talk. So Let's Talk is 30 minutes with a counselor. Now, normally, if you might be coming to kind of talk through, what counseling, what their psychotherapy might be appropriate for you, normally the first appointment would be an assessment, like an intake, to kind of understand what your condition is, what your history might be, and where you would like to go with psychotherapy services. But sometimes people are just experiencing a little bit of a distress or a little bit of conundrum, and maybe just have like a bad grade that was unexpected, and you just want to unpack that a little without going into formal psychotherapy. Let's Talk is that opportunity. It's 30 minutes with a counselor. We generally have around 30 to 40 appointments every week for Let's Talk, so it's very easy to book, and we want to make sure everyone knows about that. So we also offer testing, STI testing. We offer pregnancy testing. We also do provide evaluation for oral contraceptives or long-acting reversible contraceptives, allergy desensitization, physical therapy services, workshops for managing a number of very common conditions for sleep, anxiety, stress, and ADHD. And we also do illness and injury, same day and next day appointments. So these are some of the popular items we definitely want all of our students to know are available to them. Getting started. So one of the things that we need folks to do is to take care of completing the medical consent for treatment. This is located in MySHR. So if you see that address there, usc.edu/MySHR, that will actually take you to the login page. So in order for a student to access that, you actually need to have a net ID. So the website is, I think it's like netid.usc.edu. Oh, my colleague just put the MySHR link in the chat. So in order to get a net ID, it's your USC email, right? So you do need to go to the IT department website that will lead you to create a net ID. So you need to request a USC email address. If you haven't yet done so, this is one of the first steps. Once you have that USC net ID, you will be able to log into MySHR and see your student health record or the beginning of it. And that's where you would complete the consent form. If you are under the age of 18, there is a third-party consent form that needs to be completed. Otherwise, if you're 18 or over, you can complete that consent on your own. The second very important thing that students will need to do to come to campus is upload your immunization records and put them into MySHR. So this might be if you have electronic records, it would be uploading that or screenshots from your current portal. It could be paper records that you have that you would take a photo of and upload them. We actually have instructions on our new student health requirements site that walks you through various forms. We also have a form that you can download and give to your physician to have them fill out if you don't have a copy of your records. Now, you don't have to worry about if you have incomplete records. Just get as many of your complete records as you have and upload them this summer, because our teams will be reviewing your records and either giving you the clearance that your records are, particular immunizations are complete, or sending you a message about which requirements you do need to still complete. So MySHR will be your portal for uploading and then receiving information about those immunizations. Now, my colleagues have just put into the chat that there are multilingual immunization FAQs on our website, including some forms that are in multiple languages that you can take to your doctor, your provider office, and have them complete if you don't have a copy of your records. So that is one thing you do need to complete. If you have incomplete immunizations, you will be invited to come to what's called the Immunizations Fair, IMU Fair. That is during the first week of classes. The classes begin on August 24th, and you will receive an email about coming to IMU Fair that week in order to review your records that have been uploaded, to get any blood tests drawn to check for immunizations if you're not sure, and also to complete any immunizations that you might need to have. For our students who are from outside of the US, most students will have to review whether or not a TB test is required. So if your country of origin that you're coming from has a high incidence rate of TB, you will need to get a TB test done at USC when you get here. You can get that done during the immunizations fair. It's very important that you do that here. You can't get that done before you come into the US. You have to be in the US to do that. And that test has to be valid within the most recent 6 months and has to be in the US. So most likely you will get that TB test done here at USC during immunization fair. The third decision that many of our students, all of our students have to make is about health insurance. The deadline for making a decision about health insurance is September 11th, which is the third week of classes. Pretty much all students are enrolled automatically in the student health insurance plan, and our carrier is Aetna Insurance, so it's SHIP Aetna. Some students may have their own insurance plans, and this is primarily like a lot of our domestic students who are on their parents' plans or a spouse's plan. They have a plan that you can use and waive out of the SHIP Aetna plan. You don't have to have two insurances. But we'll talk a little bit more about looking through the criteria to make sure that you have a very good plan in place. So to go over insurance a little bit more, the SHIP Aetna plan is a national plan, which means that it has coverage throughout the United States. And it's specifically built for college students, so it has coverage for a lot of the services that we would normally see in a college population, including extensive coverage for mental health services, for any urgent care situations, emergency room visits, and so forth, prescriptions, and all of that. The cost for the SHIP Aetna plan, the premium is for fall is broken up into two segments. For fall, which is 5 months, the cost is $13.13. The cost for spring plus summer is $24.74. So the total for 365 days, the full year, is $37.87. Now that plan begins August 15th of this year, 2026, and it goes all the way through August 14th of 2027. So if you are on the SHIP Aetna plan and continue on it, you are covered basically for the entire length of time that you are at USC and a little bit after you graduate. So if you are considering waiving out of the SHIP Aetna plan and using another plan, we recommend that you make sure that the plan you intend to use has strong local coverage, particularly a good provider network in Southern California, has a reputable history with good customer service support, and that you are very aware of what your portion of payment will be under their plan, because it is a contract. So you might find plans with low premiums, lower than our plan, but you really do have to look at what that means in terms of your total cost if you try and use that plan. So it may have a very high deductible, which means that you have more out-of-pocket costs, and the plan really doesn't kick in, or that there's a lot of exclusions to the plan. So that's what we would encourage you to look at if you are debating whether to keep SHIP Aetna or to go with the plan that you might already have in place. So to explain SHIF is really your in-house. We are your in-house service. We are your primary care, and student health is powered by SHIF. SHIP, which is your insurance, it will cover anything that's outside of our house. So the yellow portion, everything that's on top. So this might be vision care, prescription medications, lab costs, vaccines, longer-term psychotherapy or psychiatry treatment, inpatient hospitalizations, urgent care center visits, or if you need a higher level of care, if you're referred to cardiology, surgery, orthopedic medicine, any type of specialties that are not part of primary care. All of these services are what is covered under an insurance plan, like SHIP or Aetna, or your own plan. And copays may apply in those instances. So if we think of SHIF as the base, which is student health, and SHIP is everything that is outside of the house. Okay. This portion, which is very kind of mystifying for a lot of folks, we're just going to give you a little bit of a brief primer on understanding insurance or insurance terminology. So the premium is the regular payments that keeps your insurance active. So your plan, you have coverage if your premiums are up to date. So the premium that you would pay as part of SHIP Aetna for fall would keep your insurance active all the way through January. The payment that you pay in spring semester would keep you active and insured from January through August. Copay. Copay is a portion of payment due for visits or prescriptions at the time of service. So for example, if you go to see a medical provider and they give you a prescription for antibiotics, you would go to a pharmacy and you would present your insurance, and your copay might be something modest. It could be $5, $10, $0, depending on the medication. So that is what a copay is. Co-insurance. So if you have more than one insurance plan, both insurances might be applied to cover the costs of your care. Out-of-pocket. Out-of-pocket is really what it sounds like. It is what comes out of your pocket to pay for your portion of healthcare. Deductible. Deductible is the maximum amount you would pay for care under your plan. So we talked a little bit about plans that have a low premium, like maybe like, $1,000 for the year. They may have a very high deductible, so that when you try and use your plan, you're actually responsible for a lot of the costs yourself before insurance will kick in to cover anything. If you have a low deductible, once you've met that maximum, insurance will take on the rest of the payment. This is particularly helpful for someone who might undergo a hospitalization or a longer term or more extensive healthcare treatment plan. Okay, this is a fun section. Our nursing team, as I mentioned, we have an extremely good team of nurses, including the ones who are part of our advice nurse team, and they actually work. They're working 24/7 through our contact center. So if you have, whether you call during business hours or in the middle of the night, our nurses will be there to give you medical advice. And some of the common things that they see with students are a lot of respiratory, a lot of cold and flu symptoms, allergies, upset stomach, fatigue, minor injuries, dehydration, bee stings, bug bites, animal scratches, minor, but they do want to get seen or have some medical advice. And all of these things, we encourage students to call us at this number, 213-740-9355, and you will be connected to an advice nurse. You can actually also use My SHR and use a feature in there called Secure Message. You can send a secure message to an advice nurse, and they will review it and respond to you. So great ways to get in touch with nursing. We do want everyone to know about after hours care. This is a little explainer card. We make it available physically on campus. They're pretty easy to find around campus. This is what to do in an emergency, or if you are experiencing symptoms and trying to decide, is this something I should go to urgent care for or an emergency room? There's quite a big difference in the cost of copay, right? This would be a copay under SHIP. And it can also be much faster to go to urgent care, where wait times for emergency rooms could be quite significant. So we encourage you to keep that QR code and list handy. This is updated pretty frequently about what are the nearest urgent cares to USC that take our insurance in the event that student health is closed and you do need to be seen in person. Okay, moving on, changing tracks a little bit, we're going to go into the emotional journey for students. So starting college is a little bit like moving, making all new friends, and having a new job all at the same time. So it's a very big transition, and it's certainly a really big transition for students who are coming from outside the US. And there's also a bit of culture shock and things like homesickness. So we recognize that this is all very normal. And we have some, in addition to our amazing counseling team, we also have some tools that a lot of our students find helpful. We have an app, it's called Nod, that we make available at no cost to students. And it's a resource that has really good tips and lessons on how to make connections, really authentic connections with other students. It can help break the ice. It can help create your social network. And making friends and building relationships takes time. And so we encourage students to be patient with themselves, with others, and just realize that everybody is starting out from the same place. No one really has that much of an advantage over anyone else. And and it's just going to take a little time, and it's worth putting in the effort. So we have counselors that are located in a number of our cultural centers throughout campus. These are just some of the locations where we have a therapist that is really assigned to this group, and they're really lovely, and they care very much about students and their experiences, and they become very familiar with the kind of common things that many students have in common. So they're really very, very prepared to talk to students. They also have drop-in hours, so students don't have to make an appointment. They can just come on in. And we also have embedded therapists that are available at some of our academic locations. And so if you are in one of these 6 schools, you actually have an assigned embedded therapist at your location, and they become very familiar with the kind of common pressures that students experience, both in their academic environment and also related to the professions that they are pursuing. So they are very empathetic, and they really learn a lot about what students go through and how to help them manage these challenging professions and disciplines. 2 resources that we would like students all to know about. One is called stayingwellat.usc.edu. This is a curated website with articles and advice, all on topics related to transitioning to college. All of these articles are reviewed by clinical specialists. There's no ads on this website. And many of the pieces are contributed by college students as well. And then we have Trojans360.com, which is created by students, and it's a blog to help people make the most of their USC experience and enhance their well-being and their social connection and just easing into college life. This is a slide that shows you how to get into that MySHR portal, usc.edu/MySHR. This will become your home base for navigating all of your medical, mental health, advocate services, all in one space. Again, this is a great way to contact us. Not only are our phone and email representatives available 24/7, when this little red button is active on our main website, you can actually begin a live chat, and a representative will be able to assist you. You can drop in a question, and they can look up your record. They can help make an appointment for you. So there's a lot of assistance you can get from our contact center by email, by phone, to connect to the advice nurse, connect to a counselor for an urgent counseling situation, and it is 24 hours, 24/7. A couple of things that we want to remind you before you arrive on campus. One is this is the website for information for all of our new students. It's all here on one website, including a couple of important pieces of information about immunizations, about insurance, about all of the things that you need to take care of. So consent and immunizations, that's probably one of your number 1 priorities. Insurance, remember the deadline is September 11th, which is the Friday of the 3rd week of classes. So if you're deciding to keep the insurance, you don't need to do anything. It's automatically there. If you are planning to waive, you do need to submit information and request a waiver. That's all through MySHR, and that information is on that website at the bottom of the screen. For our undergraduate students, we have what's called the Prevention Education Modules, PEMS. The online modules are due by the first day of classes, which is August 24th. Actually, it's one day off here. It's 8/24. So the online modules are Staying Safe, which is about safety and creating a safe community on campus. Sexual Assault Prevention, which is a required module, and Alcohol EDU, which is a required module. If you are a graduate student, your only required modules are staying safe, as well as sexual assault prevention for graduate students. So those are the 2 online modules. If you're an undergrad new student, you have a live session requirement, and that is for consent and healthy relationships. That module opens for registration. There's a early summer sessions, so students may be invited based on space and availability at a randomized group. Will be invited for early sessions, which are open July 20th and run until August 21st. And then all students are invited to complete that, scheduled to complete that module from August 24th through the first week of October. I think it's October 5th. So all students should plan to take that consent and healthy relationships Trojans Respect Consent module, either in the early summer or the standard fall. It's a 2-hour module. It's very informative and very instructive. And I think you'll enjoy taking it, and that would be in your first 6 weeks of class. The other thing for our undergraduates and for parents of our undergraduates, we do want to remind folks that there's so much independence and independent decision making that is made as a college student, so many choices. We really encourage practicing independence, practicing some of the skills that will be really helpful in coming to college, including making sure you have your immunization records, upload them on your own, pick up a prescription, make your own appointments, manage your own records. These are really great skills that will have to become like muscle memory that you will need to use all the time in coming to USC. So summer is a great time to practice all that, including starting with your consent and immunizations. So with that is the end of our formal presentation. So I will hand it over to Denise, and we can take a look at some of the questions in our Q&A. So Denise, where should we begin?
Yeah, I have a quick question about my student health bill. Would the health insurance be included with the tuition fee, or is it separate?
Yes, that is absolutely right. It will, the student health fee and the student health insurance both appear on your student bill. So if you go to SFS, studentfinancialservices.usc.edu, if you are the student, you can log in using your USC Net ID and you can see your bill. I believe the fall semester is posted, number one, after you register for classes, and it's available usually by the 3rd week of July. And then the bill is due, I believe, at the end of the 1st week of classes. So, okay, so my colleague has dropped it in the chat, sfs.usc.edu. So you will see the student health fee. You will also see student health insurance. If you are waiving insurance and your waiver application is approved, and you are approved to waive the SHIP Aetna plan and use your own plan, that charge will be reversed on your account. Okay, let's go to the next question.